All right, welcome everybody to the Module 2 Gold Standard Certification. Tonight's title, Practice Implementation. So I know everybody on this call is somebody that's in the business. Maybe you're a physician, maybe you're a virtual care consultant. And the power of our opportunity is really having a professional group of individuals out there and speaking to the physicians about the offering of Carry Health. And no better person to really lead this charge than our Clinical Innovation Officer, Dr. Dan Dyer. And let me do him a great service by giving him the proper introduction. Dr. Dyer went to the University of Southern Florida. You could see his credentials, College of Medicine from 86 to 90. OBGYN residency in Jacksonville, Florida, 93, 94 as residency. Private practice since 1998. Board member, Florida Women's Care. Chairman Section 2, District 12 of the American College of OBGYNs. President, Jacksonville OBGYN Society. Medical Director of Core Health Solutions. A founding investor. He saw the vision first. I want to emphasize that. He bought into this vision first and was an initial investor and is now our Clinical Innovation Officer. But I love what Dr. Dan Dyer really stands for. And you could read that with me, everybody. I love building things, marketing, identifying, and solving problems. Work ethic. I can say work ethic, energy, and integrity. And Dan and I go back quite a few years, and everything he says he's going to do, he has done. And that's why I know you are all in good hands to really kick off. So get a pen and paper, everybody. Stay focused because you're going to want to take in all the nuggets that Dr. Dyer will share with you tonight. So without further ado, Dr. Dan Dyer.
Hey, Jeff, thanks so much for all you're doing, and thanks for the nice introduction. Let's see, I got to go to the share screen here. Did you try? Oh, here we go. I'll pull up presentation for us here. There we go.
Perfect. We could see it.
Cool. All right, great. Yeah, so tonight, this might be kind of a little bit of a terrifying presentation because it's voluminous, but don't be afraid, guys. This is going to be all outlined with checklists. I'll go through that all with you later on. I put this together over the weekend. I had a really rough weekend on call, but as I sat down to put together the outline for this presentation, I thought, my gosh, this just keeps getting longer and longer. And really, there is so much important information here. The gold standard practice implementation is really, this is our money shot, guys. This is what's going to make your business leap into the stratosphere with success. If we can take the physician's practice, this is what we're focusing on tonight. This is we need to recruit membership too. We need to recruit members who become patients. But if we can, the goal of this whole platform and the process we're about to describe tonight is to launch the physician's practice into success immediately. And you're the experts. You're going to be the experts who serve as the resource to make those doctors successful. So I'm going to go through all of that information tonight. Maybe it's not as much as I think it is, but I think I can do it pretty quickly. But this will be easy review. There'll be checklists for you. But what I want you to really realize here is that I went through this all on my own, and there probably aren't a lot of doctors out there who have time. I had a very vested interest in understanding everything about the platform and making it work because I was a founding investor and I wanted to punch holes in it and see what we could do to make it better. So I took the time to learn everything about the platform as much as I could and had my office staff do it too. But most doctors aren't going to do that. You're going to be the resource who gets them all the information and gets in there and gets them successful from day one, because they kind of will lose interest in something that becomes a burden to them or confuses them. So tonight, we're going to go through the information that makes this in the practice extremely successful. And it's all kind of common sense. What I want you to really think about is, the service business that you're entering here. This is where this becomes, this is not a get rich quick type of a scheme per se, as many people think from outside looking in. There's work involved here because you're going to become the expert in the entire platform, the entire process of getting people in from the start to the finish, whether it's a doctor or a member. And really, truthfully, if you do this right, you're going to become your physician's best friend and their most valuable resource, because you really truly have the opportunity to change their financial destiny if we do this correctly. You can change their daily lives by creating fewer pressures for them. If we can get them to move from the way that they're practicing medicine right now, maybe towards a partial concierge practice, which we've talked a little bit about, or maybe all the way towards a full concierge practice, you're literally altering their outcome in life. And man, that's something special you can do. And they'll be thankful to you forever. And we can also, I mean, this is really important. We can create a better healthcare delivery system with physicians that are less pressured to see so many people in such a small period of time. They can deliver that more personalized service that we all desire from our physicians. And with that comes improved patient outcomes, because the patients, when they're counseled appropriately, actually buy into the treatment processes that we prescribe for them a lot more effectively. And like I said in the very beginning, this is going to be a voluminous, informative process. Please don't worry. We're going to create a checklist for practice onboarding. It's almost like before you hop on a plane to fly, the pilot goes around to check everything, hopefully, to make sure that the plane's about ready to get off the ground safely, because we want to make sure we don't leave anything out. We want to make sure that the practices have, as many of their questions answered as possible. So there'll be tools to help you with this. This is nothing you have to commit to memory, but this is something you have to commit to learn and understand all these different components that we're going to discuss tonight. So the first thing I want to talk about in terms of the gold standard implementation process in the practice is the doctor element, the physician element. And realize this, many of them, they may not express this to you, but they're going to be nervous and very uncertain about this new tool. And it's your confidence and your conviction and your knowledge base that's going to change that for them. Another thing that's going to make them very nervous and uncertain is that this is something they're not familiar with. And then if we're starting to talk about maybe altering the way that they practice medicine in terms of how they approach patient care from a time perspective, they're going to be a little nervous about that too, because they've never thought of themselves transitioning out of the current model into something different. So if we can take them there along that journey towards, a hybrid concierge practice where they're doing partial concierge medicine and the traditional type of medicine where they're on the conveyor belt because they're afraid they're going to lose too many patients, well, we can take them to that point and then maybe to the journey to the full concierge practice. So it's our capability to do that's really important with your confidence. Another thing that's going to strike a great deal of fear in them, which it did for me, was, how am I going to tell my patients who are so used to having such accessibility to me via the telephone that we're not doing that anymore? And what we have to get our doctor partners to understand it, what we're going to transition them to is really good for patient care, and it's really good for their business. That's the most important part. This is a business that we're running. We have to help them become more successful and think more like business people. There are plenty of us out there that do that, but many don't. Many are just there in the rut trying to see patients and don't think about the business component. And then also, we're going to have a lot of support materials for this transitional change for the practice in the corporate guidelines. So no worries there, guys. So in the physician elements, we're going to help overcome the fear of patient complaints. That's their biggest concern is going to be, what are the patients going to say when we make them come to the office for a visit or do a virtual care call versus me just taking care of it over the phone? So we're going to build the confidence, put a program in place as to how they're going to overcome that and make this more of a benefit for the patients. That's what we're going to talk about here is, what I've done in my practice is when the patients maybe put up a little bit of a fuss about it, we just let them know, hey, this is a benefit to you. We've been asked about more accessibility and more convenience, and here's what we're doing for you. You can either come to the office for a visit or we'll be happy to see you virtually. That's the best way that medical care is delivered. And in the letter that we've written, it basically announces it in response to an overwhelming demand from our patients for more availability. We are proud to partner with a new telehealth system presented by Carey Health, blah, blah, blah. It just goes on from there. And there'll be email announcement letters that reinforce that. As long as we can get the emails from the practices, we can do an email drip campaign about this for them. And there'll also be waiting room announcement letters so that when the patients come in for their visits, they'll be given this letter by the front desk staff to announce the partnership with Carry Health and the accessibility to the physicians through that platform. Another thing we're going to have to do is just make sure they understand how we handle those acute care needs via the phone triaging. We're not going to be doing that anymore. We're going to have the staff in their office, which we'll talk about in a few minutes, trained as to how to handle the phone triaging for them, and to make the patients aware who may not remember having read the letter or gotten that email about what the new practice policies are. And then what the staff will just be doing is when they call my office right now for a bladder infection, yeast infection, bleeding problems, the staff is trained to tell them, Dr. McDyer will be glad to see you. We'll get you an appointment here in the office when it's convenient for you, or you can see him via virtual care. And then if they engage in a question and answer session about that, my staff is all trained to tell them how to log on to the system, get the app on their phone, and then also how to enroll for the memberships they want that, and also how to just use it on an as-needed basis. And then they kind of went through that already. They teach the patients how to schedule their visits or make them on demand, as we talk about in the presentations. I think in a few minutes I'm going to go through that in a little bit more detail, so I'm just going to leave the visits at that point right there. There are certainly ways to be seen as a patient through this platform. The points of entry are what we call scheduled visits, and those are visits when the patient is leaving the office. If the physician feels like the problem that the follow-up will be taking place for is something that's amenable to virtual care, he can tell his office staff, or she can tell her office staff, that I want my patient to follow up in 3 weeks with a virtual appointment at 12:15 or something like that, or whenever it's convenient for her. They can actually go into the Carry platform and schedule that visit for the patient at that moment in time. What will happen is the platform will, at that moment when that visit is supposed to take place, will give them a little warning, I think 10 or 15-minute warning. Your visit is due in 15 minutes. The doctor and the patient both will get a text message preparing them for that visit so that it's actually on time and convenient from wherever the patient is located. So that can be scheduled at the checkout time when the patient is leaving the office. And as the new platform is released, the patients will also have the opportunity to schedule visits on their own. The doctor can actually open up his or her schedule for maybe an hour once a week for virtual visits that patients can just see, hey, my doctor's going to be available at 12 o'clock on Thursday. I want to schedule myself for that visit. And they can actually schedule those visits themselves if that's a convenient time for them. Or the doctor can open up his or her schedule to what's called on-demand visits. And that means, like I do at lunchtime, I just leave my app or my system open. I schedule it on a scheduler from like 12 to 1:30, so that if patients need virtual care, they can contact me then. Sometimes I'll do it from 5 to 11 at night when I know I've got some people out there wanting visits. So it's really customizable to the physician's desires, essentially. And what we'll have the physicians do, we'll teach them how to be able to set aside some of the time for virtual visits. In the very beginning, it may be, 2 30-minute sessions a week that they actually schedule visits for. They can put themselves on demand whenever they want. So we'll put together some ideas for them as to how to make this work. And it's good as the memberships accumulate in their practice, they're going to be available more and more throughout the week to perform those virtual visits, because it's very efficient. I mean, honestly, it was up to me. I would do most of those at lunchtime or after hours. That's when I tended to do them, because there's no overhead accumulating in my office at that point in time. It's basically free time for me to practice without paying anybody else. And those are all things we can make the physicians aware of as we go through this with them. We also importantly want to familiarize the providers, the physicians and their staff members that are actually healthcare providers too, the PAs, the nurse practitioners, and all those responsible for delivering the healthcare, what programs Carry is offering. Number one, to the physicians, we've got the registered provider program. I misspelled a word there. Preferred provider program. And then we've got to talk a little bit about the credentialing process that they'll go through, which is, they've been through it before, and this is less involved in credentialing with an insurance company, with a hospital. We just have to make sure that they're licensed physicians, basically. That's the fee of $199 to get the credentialing completed, which is really, that's a great deal with how much time and effort's involved in that. And then we also want to make them familiar with the monthly membership programs that are available, what the features are. We've got the basic plans, the $29 and $49 a month plans. And then we've got the VIP plan, which is the $99 a month per individual plan. and what that program represents and what they're responsible for in terms of accepting those types of patients. So that's my next slide here. Physician requirements to offer these plans. If we're going to be doing memberships and giving people a semi-concierge feel or a true VIP feel to the practice, you've got to make times available in your schedule to see those patients in an urgent fashion when they need the care. And you might get a little resistance from the doctors because, if our office is open, the overhead's cranking up the entire time. It doesn't stop until, and it doesn't even stop when the doors are shut because you're still paying rent on your building and paying your malpractice, etc. But it's going to be a little resistance that you'll encounter. Well, why should I open up 30 minutes of my schedule for visits that aren't on the schedule yet because I need to be seeing patients? And well, the reason that we can do that here is that these memberships create additional revenue for the doctor. So it's filling in the gap financially to make them available when there may not be somebody in that slot, but it will appear. They're going to be using that time as these memberships roll through their practice. And that's what we want to make them available for. Virtual visits, and for the VIP patients, they're brick and mortar visits that the patients actually need to be seen in the office for physical exams. So it's just a matter of making them aware that you don't worry, you're getting additional revenue for this program. If you miss 30 minutes a day of seeing patients, you're getting more than overcompensated for that through the membership programs that are there. So that's really kind of ingenious how this membership program can help the doctors buffer themselves from zero income to significant income, even when the schedule's empty per se. And that's really I think in my mind, the biggest fear doctors have when they're trying to change their practice profile and going from traditional practice where they're just on that conveyor belt seeing so many patients a day just to make ends meet to a concierge practice where there are very few patients to see, but they've got all the time in the world to spend with them. It's a nerve-wracking thing to think that there are going to be enough people that want to do that and build that relationship with you. So we have that chance to buffer them through that journey. And then really importantly, I think this is when, as you're going through this with a physician, hopefully you're developing a relationship of integrity and credibility with them, and you can sit down and almost befriend them in a way. And I think eventually if we do this right, you're going to be their best friend because of how much change you can create for them, like we talked about on that first slide. But really, to do this right, I think we need to sit down with the physician and understand what their practice goals are. Do they want to just keep doing what they're doing and just plug in some virtual care so they can handle after hours calls in that fashion? Or do they want kind of a hybrid model of their practice where they want to, because they're fearful of making that big transition to concierge medicine, they can do some concierge medicine part-time. Maybe there's a day a week that they do that, or, a session a week or a session a day where they do that, or, and then keep up their regular practice outside of that, or they want to just go full-blown concierge where all they're going to do is just take patients who pay the $99 a month membership fee and then see them in their offices. So, if we can explain this well to the physicians as to what they can accomplish with our programs, and we can sit down with them and have an honest conversation about where they want to be, 1, 3, 5 years down the road, and we can help them put together a plan as to how to get there with all the different components that we have in our program. We're not out here trying to be concierge coaches, but we're here to coach the doctors through some very difficult times they're experiencing right now. We've got the capability to do that with the program we've got in our hands. And just realize most of the doctors, they're going to be really timid about engaging in such abrupt changes. I think everybody, generally speaking, hates change, but most of us on this call, you're adapters, guys. You understand the only constant, truthfully, is change. And you've got to keep up with it. And if you don't, you're going to be left in the dust. So it's a matter of helping doctors build that confidence and conviction that they can do this, and this change is good. It's good for them, good for their patients, which is very obvious. And then, getting into the real nitty-gritty of this, you want the physicians, once we've gone through all that, to understand the true logistics of operating the platform, because there are points of confusion there potentially. And you'll hopefully have a chance here in the not too distant future to play on the system and see how it works. So you'll get a full understanding. We'll have to put together kind of a beta test site for you or something of that nature, so you can actually pretend to be, you can play doctor. Yep. And it is so cool, guys. It's really neat to be in the driver's seat of this. And, I haven't even really used most of the features, but its future potential is phenomenal. So you'll be able to be the expert on that and show the doctors how the notes are written, where they are stored, how they're filed, all those types of things. You'll go with them how to perform a visit, how to write a note in the what we call the SOAP note section, that stands for subjective, objective, assessment, and plan. Teach them how to write the prescriptions, which is most of them are familiar with that anyway because they're doing electronic medical records. If they're going to get involved in this, they're doing EMR already, so there's not a big worry there. And then another important component, which is really a game changer for us, is this next step is how to assemble a spillover network. Who are the doctors that you want to share your call with, per se? Who do you trust to take care of your patients? Who's going to do a good job? They're not going to alienate your patients. And as a matter of fact, with our cloud-based physicians, if you run into a doctor who doesn't have a call group or a group of people that he really trusts, there are some absolutely spectacular physicians in our cloud that do nothing other than virtual care, guys. It's amazing. That's their full-time practice. They are so into this, and they're so advanced in terms of, they're talking about what the lighting is like in the room, the camera they're using, the angles, all this stuff, how it makes them so much more successful than maybe competitor doctors out there. So we have a phenomenal resource for them if they don't have their own spillover network physicians. And I just put a little asterisk to remind me to reassure you guys, don't worry, we will have videos for all of this too, so you're not going to have to go back to the doctor's office day after day, week after week. However, you will want to have, I haven't figured out what the right timing is. Jeff and Lisa and I and Matt and some others will need to talk about this, but this isn't a one and done thing. Hopefully you're going to become that friend of that physician, and you're going to want to go back and do a checkup a week later, 3 weeks later, 5 weeks later, just to see where they are in their process of transitioning and succeeding with the telehealth component of their practice. Because why? Because doctors are really easily frustrated. Realize this, they're into protocols, man. They don't have a lot of time to think things through. They're almost like, we're almost like primitive in a way. Stimulus and response, stimulus and response. We know how to get to things from point A to point Z very quickly. And we don't like things getting in the way, because when something gets in the way, it slows us down in our daily processes. So we want them to integrate this very successfully from the first moment they get on, and it's not going to be an impediment or an interruption in their daily activities. And now I just hit the spin button on my, let's see, I got to go back a minute, guys. I may have lost myself. There we are. Okay. So next slide. Very simple things. How to make yourself available or unavailable. There's a little switch there. It's actually in the scheduling program. It's very simple to do. You either schedule yourself on or off. And here's something that I did in the very beginning, and I think this works really well. And I don't think many doctors understand this, man. Your office staff, they're your best proponent for success. And if you're bringing something new into the practice that benefits you financially, you ought to share that with your staff, man. If they can play a role in helping implement something new in the practice, they ought to share in that, because you want them to buy into it. You don't want this to be a barrier to their day either. They're into protocols too. They got a lot of phones ringing and stuff like that. So you want to give them a financial incentive to participate in this with you. What I do is I do quarterly bonuses for the staff and just see how certain programs are working, and they absolutely love that, because they're kind of selling things for me, which is, it's a great thing, because they believe in it and they buy into it. And what I did too is when we first got on board with Carry Health, I bought memberships for all of my office staff. I wanted them to touch, taste, and feel it, so they could tell the patients how it works, how great it is. So, and it's not expensive. I mean, goodness gracious. So they love that, man. They all use it. And then also another thing we want to touch base with them is, there is a professional referral program. Dr. McDyer, once you see the success of this and how it really engages your patients and you're delivering better care, we'd love it if you refer your colleagues to this. And for that, you'll get a 10% referral fee from all of your colleagues' memberships that are generated through this program. That's huge, guys. I mean, that's unfound money right there. So that kind of concludes the physician staff element of this entire implementation process. There may be a few things I left out. I'm going to go back through this and make sure we've got it all before we launch it on the learning management system. Now, the office staff element I was just touching on a moment ago, because they're the doctor's big proponents for all of this, and they can make something succeed, and at the same time they can make something fail very miserably too. So they need to know about this whole platform also, not the ins and outs of working it, but the scheduling. We'll have to go through them, like a little in-service on how to schedule patients, which is really simple. Train them about the different types of visit options, like the office visit. When the patients call in with a problem, we can come in for an office visit or virtual visit. We'll teach them, or have just a training on how to talk to the patients, because they get nervous too when the patients put up a fight about things. We're just delivering better care. This is the practice policy. We either have you come in for a visit, or we can do the visit virtually, but we're not doing telephone care anymore. So we'll go through with them how to explain this. Training about the membership program features. That will certainly add a lot of success to the adoption rate when the staff is a proponent and educated about it. I think I touched on this a moment ago. Training about the scheduling the virtual visits. Like I said earlier, when we were talking about the physician element, there are scheduled visits that can be set up right as the patient's checking out if it's something the doctor feels is amenable to virtual follow-up, and there are tons and tons of those types of things. Lab visit follow-ups, lab result follow-ups, counseling follow-ups, even some minor surgical follow-ups just to check wounds and things like that. Counseling for depression, diabetes, hypertension, anxiety, all kinds of things. So it's a matter of making the doctors aware, hey, you have to have the patients come in for all these visits. The patients actually have the ability to schedule for themselves when the doctor's schedule is opened for scheduled visits by the patients. And then we talked about the on-demand visits and how those work. So the staff just needs to be aware of those different elements there. And then they probably ought to know what the patients need to go through to enroll as a member. My staff all knows that. When the patients are on the call requesting telephone care, basically, they let them know how to go to the website, download the app, and then look at the memberships. They can explain that to them. They're all familiar with it. So it's really a great process that we've got in place. And then we also need to train them about how to request a visit with a doctor, which is it's that probably doesn't need to be that. That's self-explanatory. As you go through the app, it actually queries you, are you ready to request a visit? But once again, do not worry. We will have videos for all of this, guys. Well done videos and animated, educated videos that are going to be on the website. You'll have them in your toolbox. It's going to be phenomenal. And actually, I did bring something for you here. I don't know if you've all seen this. This is our video brochure, which will have some of this information in there, which will be in the physician's office, in the waiting rooms, and then also in the exam rooms if they so choose. And I'm going to just open this up for you. This is a video brochure, so maybe you can see it start playing. Is it working? It's the old company name, sorry.
America in general is trending quickly toward an urgent care.
But it's absolutely beautiful. It's striking when people touch this, how well this has gone over, guys. And there are 3 stories in there. One is about why we're building Carey Health. There's one in there about how to sign up, or why to sign up as a patient member, and then how to use it. So it's really, and each one's about 3 minutes. So it's really well done. The other marketing, oops, did I hit my button? Sorry, guys. There we are. Okay, so that's the staff element. And then, oh boy, I was thinking like I was when I wrote the outline the other day. I was going to show this to you right then. And here it is on the next slide. Perfect. So the kind of turnkey marketing components that we have for the campaigns to make patients aware about this, it's really kind of a practice policy change. Is there going to be, I already have written these patient announcements letters to have at the front desk when they check in for their visits. And these are all customized for the practice. It's kind of co-branded. In my office, it has the Carey Health logo along with my practice's logo on the letter. So it's like we're working together to make this whole thing happen. So there's an announcement letter for the office. There's an announcement letter email campaign that we can drip on the patients on a monthly basis, or maybe twice a month, however we think is most appropriate. There are beautiful posters that we've designed that are customized to the practice. Some of them have my mug on there from my practice. Just to get the awareness out there. And they're absolutely beautiful, guys. These are not just some mamsy-pamsy posters been put together. It is gorgeous. The video brochure, which I just showed you, there are beautiful pamphlets we got in design work right now. And then we also can assemble, if I think a lot of physicians now do have video monitors in their waiting rooms, we can have a customized video for that practice describing why we've transitioned to virtual care. The doctor can do it themselves. I've got those running on my website, and then also they'll be in the waiting room too. I've gone to the production studio and filmed a variety of different videos for Carry Health just to kind of experiment with them a little bit. So there's a full suite of options we have to really make this a robust offering for the practice and to make it very successful with adoption for the patients. So that kind of concludes our training module. I guess I did that pretty quickly. VCC certification module number 2, the gold standard practice implementation processes. I think the key points here is that, your increased knowledge is going to certainly increase your confidence in what we're doing and your conviction. You're already convicted. You already know that what we're doing is the right thing for everybody. And then that transitions into really creating immediate success. When you can convey those messages to the practices, their staff members, and let them know we're here for you. We're here to provide a service to help you and help your patients. It's the key to success. And our key here is we want to create it immediately, not wait a few weeks and go back and see the doctor. We want to get it from day one, the moment they're starting on this platform, to get using it, get used to it, because it is the future of medicine. There's absolutely no doubt about that. So with that, guys, I want to thank you so much for your attention to this tonight. And we look forward to the next set of training modules. It'll be next Monday. We got to figure out which one we want to do, Jeff. I can make up another one between now and then for my third one. I've got 3 to do. Just excited to share this with you because knowledge is power, guys. And I am very appreciative of working with you and look forward to building your success and really helping transition the delivery of healthcare. Anything you want to add in there, Jeff?
No, I think you did it. 30 minutes of great nuggets. And I think the best thing you said, Dan, I loved it. Don't worry. Don't worry.
Yeah.
Okay? And, go out there, get out there, talk to the doctors. And if you don't have the answers, there will be somebody that can answer those questions. So don't let it paralyze you from going out there tomorrow and speaking to the doctors. So with that, next Monday, Dan, if I'm correct, right? 6 o'clock, module 3?
Yep.
Perfect. If we get a bunch of thank yous,
Pacific.
6 p.m. Pacific.
That's
and if we get a bunch
very
of
nice, guys. You're
Dan,
so welcome.
and hopefully he comes back. Dan, if you get enough thank yous, will you come back for module 3?
Oh, yeah.
Okay.
Right, I got to do it at some point. I might as well do it now, right?
That's right. Thank you, guys. Appreciate you.
Yep.
Thank you so much.
All right, guys. Have a great night.
This has been recorded and it'll be on the website.